Our last presentation for this session is by our well-known doctor, Dr. Jitendra Jathani. His pioneer work done in the ophthalmology.
So good morning, everybody. There was a landmark paper in 2010 by Brand-Holden Institute in ophthalmology, where they showed that almost 1.9 billion people were myopic in 2010, and this data was extrapolated, and they found that this was projected to have an increase to almost 52% by the end of 2050. So we know, with this background, we also know that there was a wonderful meta-analysis done in 2020, which was published in BMC Ophthalmology, where they suggested that low outdoor activities and near work were one of the significant factors involved in progression of myopia. Now, with this background and with lockdown, imminent near work, secondary to COVID-19, which had serious concerns about raised or increased screen time and low outdoor activities, more near work, we did a study to present a review of children who were already myopic, who were already in our clinic, and were myopic, were not on any treatment for myopia, just wearing glasses. These were the children who were regularly followed up for another 6 months, and after that 6 months, one of the eye was chosen to remove any bias which can arise on taking the two selection bias. The pre-lockdown included children who had already had a 1-year follow-up, and they were progressors but did not want to have any treatment. So that was the difficult part, and that is the reason we have a very small sample size, because most of our children who present to us, we try to convince them that since they are already a progressor in myopia, they should have something to stop their progression. All the children had detailed ophthalmic evaluation, descriptive and inferential statistics were performed. Because it was a non-normal distributed data, there was only 30 patients, we did use median instead of normally we use a mean for this, and we use first and third quartiles and interquartile ranges, which I will be showing. So the mean age was 8.7 years, but mean progression in myopia per year prior to lockdown, when they were progressing normally, was minus 0.75 diopter. This is median, with an interquartile range of 0.5 to 0.75, and post-lockdown it was 1.25. We also calculated the axial length, and we found that post-lockdown the median was 0.63 compared to pre-lockdown, which was 0.24. So correlation with near work is well known. It is well known that that near work, ocular strain, increase in indoor timings, and can cause increase in axial myopia. This was predicted by a wonderful letter to our editor from Narayan Netralaya by Sumita et al. They predicted during the lockdown that there could be a spurt of increase in myopia. They in fact found in their OPD numbers that there was significant rise in refractive errors. A similar increase was also noticed in school screening examination, which was done in China. The problem was that it was unclear in their study whether they used the same set of studies or they just did two set of studies and had a screening protocol for children. There was another study which was a good study by Chang et al., which was more comprehensive, where they divided the study into 4 rounds with 3 periods depending on the lockdown policies, whether there was a complete lockdown or not. The study had a very large sample size, but again it was more of a screening study. They did not do a cycloplegic refraction, nor did they do a biometry, but it was a population-based study, so that was a good part of that particular study. The strength of our study is that it was done on the same set of children who were reassessed at multiple intervals. So we knew these same children pre-lockdown and post-lockdown. Hence, we could show that lockdown was one of the important factors for the increase in myopia and axial length. The reason for this myopia, this increase in myopia could be implicated directly to the increased indoor time and near work, which is already a known risk factor. The limitations, obviously, the number was small. It was a retrospective in nature. And obviously a better, larger sample size at this point, since lockdown was unpredictable, it was unplanned. We believe that these children can be followed up further, and we can see whether the myopia progression reduced in them or not post-lockdown. So we can easily conclude from our study that myopic progression was significant during quarantine period, and therefore it calls for strategies to prevent this. So this is a wonderful insight we got, that quarantine or near work or indoor timings do increase the progression of myopia. And since Dr. Praveen is here, I would like to say that we should include this in National Myopia Prevention Program with Orbis and Vision 2020 already, looking for childhood blindness. I mean, that's a chief area of interest. It would help in creating awareness and detecting these children early, and would help in formulating policies to prevent myopic progression further. Thank you so much. Thank you for the time.
You have seen mainly it's a near work correlation.
Near work indoor timings because of the lockdown, yes, sir.
And it may be something other way around, the children, they have not gone outdoor.
Yes.
That may be one of the factors.
So these are two factors, near work, indoor timings. We saw the two things only.
Thank you.
They did not get free air, oxygen.
Thank you, Dr. Jitendra.